All right, today we are diving deep into some serious medical detective work. We're going to solve a puzzle that doctors face, diagnosing a really tricky heart infection called infective endocarditis. Let's see how they piece all the clues together.
It almost sounds like something out of a sci-fi movie, right? The idea that an infection deep inside your heart could actually leave clues on your fingertips. But it's absolutely true. And that's our starting point. So let's get into it and see how doctors follow these trails to crack the case. Every great investigation starts with finding that first piece of evidence. For a doctor, that means a really careful physical exam, just looking for these subtle outward signs that hint at a much bigger problem on the inside. So one of the first things a doctor might notice are these things called splinter hemorrhages. They're these tiny little reddish-brown lines right under the fingernails. What's happening is that small blood clots are damaging the tiny blood vessels there. Now, on their own, they don't prove anything, but they're a huge hint that makes a doctor stop and think, okay, let's look a little closer. Next up, the medical detective might find these small reddish spots on the palms of the hands or the soles of the feet. These are called Janeway lesions. They're caused by little clumps of bacteria that have broken off from the heart and traveled all the way to the skin. But here's the really interesting part, the key detail. They're totally painless. And that distinction is going to be super important, as you'll see with our very next clue. And here we have their counterpart, Osler's nodules. Now, these also pop up on the fingers and toes, but they're caused by your body's own immune system fighting the infection. And because of that, they have one big defining characteristic. They hurt. This simple difference, painless versus painful, is just a perfect example of the kind of tiny detail that can steer an entire diagnosis.
So you've got splinter hemorrhages, you've got these lesions, you've got nodules, maybe a fever, you've got all this scattered data. How do you go from just a suspicion to being certain about the diagnosis? I mean, you can't just guess, right? You need a system, a really structured way to weigh all the evidence.
And that brings us to the official rulebook for this entire investigation. This is where medical science gives doctors a clear, evidence-based path to get to a definitive answer. Let's take a look at the tool they use. It's called the Modified Duke's Criteria. And honestly, the best way to think about it is like a diagnostic checklist. Now, this is so important because it standardizes the whole process. It makes sure that doctors everywhere are using the same logic. It's really designed to cut down on misdiagnosing a disease that can be fatal by moving from these scattered clues to a solid conclusion. Now, not all the evidence is created equal. The criteria are split into two groups, major and minor. The major criteria, well, those are the smoking guns, the pieces of evidence that are just undeniable. The minor criteria are all those important supporting clues that help build the rest of the case. The first smoking gun is the blood culture. This is literally like catching the culprit in the act. They take a blood sample, and the lab can actually find and identify the specific bacteria that's causing the infection. So finding one of these usual suspects, like Staphylococcus aureus, well, that is a massive piece of the puzzle. The second smoking gun is getting eyes on the crime scene itself. An echocardiogram, which is basically an ultrasound of the heart, can show direct visual proof of the infection. Doctors are on the lookout for what they call a vegetation. It's a clump of bacteria and blood cells literally growing on a heart valve. Or they might see an abscess, which is a pocket of pus inside the heart muscle. Or maybe a new problem with a prosthetic valve, like it's starting to come loose. It's direct visual confirmation that something is very wrong. Okay, now let's talk about those minor criteria. This is where all those initial clues we found, remember the Janeway lesions and the Osler's nodes, this is where they fit into the official investigation. They count as supporting evidence, right alongside other things like having a fever, a pre-existing heart condition, or even blood cultures that look suspicious but don't quite meet that smoking gun standard. So here's the crucial part. It's all about how you combine these clues. To nail down a definitive diagnosis, a doctor needs to follow one of three paths. Path 1, you find two smoking guns. That's two major criteria. Path 2, you find one major criterion plus 3 of those supporting clues. And finally, if you don't have a smoking gun at all, 5 minor criteria can be enough to confirm the diagnosis.
All right, so we know the rules of the investigation, the rule book they follow. Now, let's look at the actual tools and tests the medical team uses to go out and gather all this critical evidence.
So the investigative tools match up perfectly with the criteria, right? First, you've got the echocardiogram, usually starting with the TTE, which is an echo through the chest wall, and then maybe a TOE, which goes down the throat for a much clearer picture. That and the blood cultures are all about hunting for those major smoking guns. Then, you have all the other tests to gather evidence for the minor criteria. This can be things like a fundoscopy, which is an exam of the back of the eye to look for clues called Roth spots, and even simple blood and urine tests that can show the body is under stress from the infection. So, after gathering all the evidence and checking it against the Duke's criteria, the investigation finally reaches its conclusion. It's time for the verdict, and more importantly, a plan of action. And there you have it. By systematically applying this checklist, the medical team goes from having just a collection of weird symptoms and clues to a confident, confirmed diagnosis. The mystery is officially solved. But, solving the case is really just the first step. That verdict immediately kicks off an action plan. Treatment starts right away, usually with some powerful IV antibiotics. And those blood cultures are key here too, because they tell the doctors exactly which antibiotic is going to be the most effective against the specific bug they found. So think about that journey, from a subtle little line under a fingernail all the way to a definitive diagnosis and a targeted treatment plan. It's a pretty remarkable process, and it just highlights why having a system like this is so incredibly powerful. It's not just about solving one medical mystery. It's about having a reliable method that saves lives. What does it say about modern medicine that we can take something so complex and turn it into a checklist that works?